All right. So as I was just introduced, I'm Dr. Andre, and I'm originally from Germany, but I've been in the region for very long right now in Malaysia and Singapore. And so if you see me, I can speak English, German, and I can speak fluent Singlish. So I can order the coffee at the kopitiam in local style. No worries about that. So I'm glad to talk to you today about lifestyle behaviors as a topic you might not think relates to public health. What I really want to quickly go through is what are lifestyle behaviors and why in public health do we actually care about these behaviors? And to start out, I guess it's a good idea to quickly think about what impacts health. And if you ask people on the street, and maybe you are asking yourself right now, what is actually impacting health? Oftentimes people will say, oh, it's all about my genes, right? I got this disease, or I'm like this because of my genes. Or people talk about the medical doctors or medicines. But actually, this graph and many people in the field will tell you health actually impacted a lot by our lifestyle behaviors. And these lifestyle behaviors are basically things that many people do on a daily basis, and they have nothing to do with medicines, doctors, clinics, or hospitals. And I'm just going to show you the big 6 lifestyle behaviors people often refer to when they talk about what impacts health in terms of lifestyle behaviors. So these big 6 are really the most important behaviors that we do in our daily life that really have a very strong impact on our health. So we can see here smoking, for example. So if people smoke, they have a very high chance of developing, for example, cancer. Similarly, if you drink alcohol, there's a lot of risk for injuries and accidents and other liver-related diseases. Then we have diet behaviors. And I think you know what we eat and how much of it really makes a huge difference on our health and well-being. Similarly, sleep. Previously, people didn't think much about sleep being so important, but the research tells us it's actually really important because after all, we should spend about 30 to 40 or 30 to 45% of our lives being asleep. So it has a lot of things, and it has a lot to do with our health. Physical activity. How much do we move has really a strong impact on our health. And I think that's something you all know. But maybe you didn't know that sedentary behavior, or the time we spend sitting or lying down without using much energy, has also a very strong impact on how healthy and well we are. And as you can see here on the slide, at the bottom, you can see the guidelines for all these behaviors. And I invite you now to maybe take a minute or maybe 30 seconds to look at these guidelines and think about whether you are adhering to these guidelines. So, do you smoke or not? Are you drinking or are you not drinking alcohol? Do you eat enough fruits and veg? Do you avoid too salty things? Do you avoid drinking or eating too much of sugary stuff? Do you sleep about 7 to 8, 9 hours each day? Do you get about 30 minutes of more vigorous exercise each day? And how about your sitting time? Do you sit most of your day or more than 8 to 9 or 10 hours? So I give you maybe 20 seconds to think about this, because after that, there will be a little moment of truth. Okay, so here we go. I hope you can help me filling up this little survey. So you just need to scan the QR code on top and then answer the question, how many lifestyle behaviors do you adhere to? If you smoke and drink a lot, if you don't eat healthily, don't sleep enough, if you don't move very much and sit all day, then you probably have 0. But I hope you can answer this question in the next 30 seconds to maybe a minute. For the first responses coming in, great to see, and it's okay. I can give it another 20 seconds. So I hope we can get a few more responses. Yeah, thanks for doing this and for also being honest to yourself. Okay, the last 10 seconds. All right. Thank you so much for the response. I mean, we can see that there are a few people who hit 5 or more of these behaviors. And I can tell you right now, you are the exception and a big outlier. That is not very common. But we have also people who only do 1 or 2 of these behaviors, and the others are sort of in the middle. And for all of you, so about 3/4 of the responses, I can tell you, you are not alone. When we look at sort of global picture on health behaviors, we can see that most people do not adhere to many of these behaviors. And you might think, well, what does this have to do with Singapore? That's just a global picture. But unfortunately, Singapore experienced a very similar scenario. In Singapore, the biggest problems are our diet behaviors, too much salt and sugar. It's about sleep. A lot of people don't sleep enough, and maybe you've heard that Singapore is one of the most sleep-deprived places in the world. Many people don't move enough throughout their day. And lastly, Singapore is a high-income country, which means also that a lot of people work in offices and they sit a lot each day. And you might wonder, okay, so what? Health behaviors, yeah, well, fine. And I know it's, I'm not adhering to them, but does it even matter? What do we care? It actually matters a great deal. Because when you look at the graph here on the left-hand side, you see all these behaviors: unhealthy diet, physical activity, tobacco use. And you could add the others as well. You see that they are linked to all these indicators that make us worry about health. Maybe you can relate to the idea of obesity. If you have an unhealthy diet, you don't move as much, there's a high chance of you developing obesity or overweight at least. That links straight to these chronic conditions that are responsible for about 80% of all deaths in Singapore. So we could say that lifestyles and the way we behave and what we do each day impact the lives and deaths of the people of Singapore to a really large degree. So we really need to look at how can we address this problem. I would like to tell you how to do that, but I will leave you with saying, don't put your head in the sand. The situation is not really good, but there's a lot of hope, because if you study public health, you can actually get some answers of how can you help people to engage in more positive health behaviors and therefore improve their health and well-being. But since you have joined the session, there's also one perk I have for you, and one thing that will really hopefully save your life. What I've prepared for you is something I call a movement break. As we know, sitting too much is really bad and moving is really good. I would suggest that you all follow along with the next video that goes for about 2 minutes and just shows you some light movements you can do, and hopefully you will feel some immediate health impacts. So here you go, just follow along for 2 minutes.
It's time for our quick, refreshing movement break. If you can, just get up for a short while and follow some light moves.
This could be you sitting on your computer every day. And now it's time to move, so you walk on the spot for a while. Okay, I hope that was helpful for you, and I hope you feel that I probably saved your life, at least gave you a couple of extra healthy minutes or hours in your life. And with this, I will say thank you so much for being around, and I will hope I see you soon in one of my courses. Thanks, and then take care.
Okay, thank you, Dr. Andre. Next, we have Dr. Raymond Lim, who will be sharing about the topic Why Public Health. Dr. Raymond Lim is a public health physician and senior lecturer at the Saw Swee Hock School of Public Health at National University of Singapore. He oversees the minor and second major programs in public health at Saw Swee Hock as the director of both programs. The other concurrent appointments which he is currently holding are the director of student life at Socio School of Public Health and the director of the National University Health System Preventive Medicine Residency Program. His research and teaching areas are health promotion, behavioral science, public health communication, diabetes, sexually transmitted infection, human immunodeficiency virus prevention and control, public health education evaluation, and pedagogy. He's the first author for over 40 publications, and these are found in international reputable journals covering his research and teaching areas. Dr. Raymond Lim, please.
Thank you, Suni, for the kind introduction. Good afternoon, everyone. Welcome to the online NUS Open House. I will kickstart the session by giving an overview of what is public health. Hopefully, this can help you to clarify some of the misconceptions surrounding public health and give you some insights into what we as public health professionals do. I will start by asking you a few questions. Not to worry, these are not the questions for university entrance examination, but it would probably trigger you to think more in depth as to what really constitutes public health. First, does public health encompass the control of disease and promotion of health through sanitation to ensure a healthy environment? For example, around 500 BC, the ancient Greeks and Romans have already begun actively practicing community sanitation measures. Or is it public health role to prepare for disaster response, both for natural disasters as well as human-made threats? Or is it the role of public health to prevent and control the various risk factors of chronic diseases, such as unhealthy dietary habits, physical inactivity, sedentary behavior, and smoking? Or is it public health role to prevent and control the various outbreaks, epidemics arising from novel and emerging infectious disease? If your answer is yes to all of the above, I congratulate you on appreciating the broad spectrum of public health work. If your answer is no to any of the above, then all the more I encourage you to stay on for this talk so I can clear up your misconceptions. I refer you to the definition of public health given by Professor Charles Edward Winslow, who was a highly regarded American public health expert. His definition of public health remained highly relevant till today. He defined public health as the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of the community. This is in contrast to clinical medicine, which focus on the individual patient and treatment. But for public health, the focus is on prevention, which is always much better than cure. So how then do we take a look at the public health situation in Singapore? In Singapore, public health professionals work as executive, manager, and director positions in various settings, such as healthcare-related statutory boards and agencies, hospital operations and affairs, healthcare resource and finance, community health, and the regional health systems. They implement public health programs, develop policies, administer services, conduct research, and regulate health systems to improve community health. Therefore, the scope of public health is very broad, particularly in today's context. Taking obesity as an example, it is not only a global public health problem, it also affects Singapore. We know that obesity is influenced by a diverse range of factors, from individual lifestyle behavior to upstream factors, including food and physical activity environment, policy settings, and economic systems. Tackling this public health issue, therefore, requires action by various parties. Public health-related work in this area could engage from educating the population on healthy eating habits, designing and changing the environment to increase population physical activity level, as well as working with various stakeholders, such as the food industry, to develop healthier food products. Therefore, given the wide range of public health work, we see that the field is indeed multidisciplinary in nature. Therefore, it is not surprising that modern public health practice requires professionals from different backgrounds. These diverse disciplines, which are not exhaustive here, include life science, psychology, sociology, geography, social work, economics, communications, computing, engineering, architecture, business, and many others. These disciplines are also the first major where most of NUS students study. Therefore, public health as a second major or minor will be highly relevant and complement most of NUS studies' first major. More importantly, it could also open up another route of employment for you when you graduate. So why would you, as a prospective NUS student, be interested to enroll in our public health educational programs? We actually posed this question to our students through a study, and we found that there were 5 top reasons for them doing so. Check out these reasons to see whether they apply to you too. Among those who were keen, a quarter felt that public health courses were interesting. Another quarter felt that it is relevant in today's context, especially as Singapore is grappling with an aging population and many of the health problems we are facing has a social dimension to it. 1/5 of the students also hope to obtain more comprehensive training in public health. Another 1/5 cited the prospects of securing a job in the field of public health or healthcare. The last 1/10 felt that it would be complementary to their current major. The Saw Swee Hock School of Public Health is the only national school of public health in Singapore. We currently offer the minor and the second major programs in public health. I show you here the program objectives. In short, the minor program allows students to appreciate the multidisciplinary role of public health in preventing disease as well as improving the health of communities. The second major program, on the other hand, is designed to complement students' first major, grooming their soft skills and perspectives to work effectively as public health professionals or in public health teams. Students will graduate with the knowledge and approaches needed to address today's complex public health challenges and to improve population health. Ever since the start of the minor program in public health by our school, there has been a gradual increase in the student uptake through the years. In fact, it is currently one of the most popular minor programs in NUS. For the second major program, which was just recently offered 2 years back, we are still in process of collecting the evaluation data. For the evaluation of the minor program, student feedback has been largely positive. As seen here, students found that our lecturers are passionate about their fields and that the program actually broadens their career opportunities because the program is recognized by various public health employers and stakeholders. As of 2023, the school is proud to announce that we have about 653 NUS graduates with a minor in public health, and the numbers are still increasing. So, where do students who receive public health tertiary education in a university find employment? I show you here the various settings. The list is not exhaustive. The first group would be international public health related organizations. The second group would be ministries and the various government agencies. The third group would be the public and private healthcare organizations. The fourth group would be the non-governmental organizations and foundations. Last but not least, the fifth group would be pharmaceutical companies and organizations. Perhaps at this stage, one question might pop in your mind. Could I try a few courses to see whether public health indeed suits me after I have successfully enrolled in NUS as a student? Yes, definitely, which is why I'm going to showcase you some courses which might be of interest to you. First, we offer the general education courses where NUS students could choose to fulfill their general education requirements. This is the Public Health in Action course. From the global increase in obesity to COVID-19, students will get exposed to a range of public health issues and they get to explore solutions in differing contexts through the world. You will also get to work in small groups where you could debate and evaluate the various paths to addressing various global health issues in a variety of social cultural contexts. This would enable you as a student to develop an appreciation of how complex public health problems can be. And obviously, we also want to address these issues using culturally appropriate ecological solutions. These are the feedback from the course. As can be seen, students like the exposure to a wide variety of topics, and they have learned how public health can be implemented in many other sectors. We also have courses offered in the special term, which might be of interest to students during their vacation period. One such example is the course on health of the poor in Asia. This course introduces students to global public health with a focus on health issues among some of the poor in Asia. Key issues explored by the course include the following. For example, what are the priority health issues that dominate the global health agenda today? What are some of the important societal factors that determine disease burden and adverse health outcomes in this subgroup? Last but not least, what are the community, health system, and policy levels that are available to reduce some of these social economic disparities? These are the feedback from the course. As can be seen from the feedback, students found this course to be an eye-opener. They learn not just about the healthcare and the healthcare systems, but more importantly on poverty and societal issues. I know that future career prospects would continue to be an important consideration in your mind when you make the decision to choose a university. So do faculty members like us in the school. We are utmost concerned with the future career prospects of our students. We have the internship course Public Health Practice, which is a capstone course under our second major programs, as well as this is an offer as an elective under the minor program. Basically, this course introduces students to the public health infrastructure and functions in Singapore, as well as provide you hands-on exposure to work by way of attachment at various selected public health agencies and ministries. It allows students to explore career opportunities in public health, develop essential skill sets, specifically soft skills such as management of resources, interpersonal relationships, communications, and advocacy, as well as, more importantly, provide you a practical exposure to selected public health careers. These are the feedback from the course. As seen from the feedback, students appreciate the hands-on exposure, which allows them to translate what they have learned in the classroom to the real-world setting, as well as to get the opportunity to meet experts from various fields. With that, I have come to the end of my presentation. I hope the talk has given you a clearer idea of what is public health. I hope to see you in NUS one day and enroll in our educational programs. Thank you and all the best.
Thank you, Dr. Raymond. So next we have invited Miss Amy Ng back to share her experiences. Amy graduated in the year of 2018 with a minor in public health and is currently pursuing her Masters of Public Health. She is now an assistant manager with Group Integrated Care at the National Healthcare Group. Amy, please.
Hi, thank you. So, first of all, I'm very grateful to be invited back to share my experiences. I actually think Prof. Raymond already covered like all the reasons why we should want to take public health, and a lot of my experiences also fall into I think all the points that he has raised. So for my section, I think I'll probably do a bit more storytelling um, on how I came to choose to do a minor in public health and what led me to decide also to take the master's. So first off, just to share a bit about myself, I actually graduated from NUS in 2018 with a major in economics and a minor in public health. So since 2018, I've been working in the healthcare sector, specifically in elder care. So I started my first job at the Agency for Integrated Care, and since then I've moved on to NTUC Health under the Residential Care Division, which looks after 6 nursing homes. Then as of last year, I also decided to undertake postgraduate studies with a graduate certificate in health informatics, and I'm currently pursuing the master's in public health. So now looking back at my undergraduate days, I'm very glad that I decided to take the minor in public health. So to be honest, I didn't start off with the intention of going into healthcare. Rather, I kind of landed into it. So when I graduated from JC, I was looking for a temp job to fill in the time until uni started. So probably not too different from what all of you are going through now. So during that time, I actually found a job as an admin assistant under the Clinical Standards and Improvement Department at Tan Tock Seng Hospital. So this was my first job, and working at TTSH, it really allowed me to see beyond the clinical side of healthcare, which most commonly we think of like doctors and nurses. So providing care is actually so much more than that. There are like your background operations, governance, finance, procurement, human resources, and a lot of other components, supporting teams that actually help the organization to successfully deliver care. So, and if you extrapolate, public health is like the macro version of that, right? So anyway, from my first job, essentially, I found passion and meaning in the work. So it inspired me to apply for actually a healthcare scholarship and also to take up the minor in public health. Okay, so what I have learned from the minor, it's really taken me through, I mean, both in my personal life and also in my work. So firstly, it helped me to develop empathy for people outside my social circle. So before taking the minor, I hadn't really interacted with vulnerable populations like the elderly. So the experience of taking the minor pushed me outside my comfort zone. So for example, like in some of the modules, I learned about the process of aging and the influences of our community and our environment in affecting the physical, social, and mental health of our seniors. And then following from the point of empathy, it also gave me exposure in understanding the health and social issues in Singapore, as well as how Singapore's systems and policies are developed to try and address these issues. Okay. Lastly, on the third E, the minor taught me to think critically and evaluate if I am heading in the right direction to solve a problem and if I am doing it the right way. So one of my favorite modules was the designing public health programs, which was taught by Prof. Liao Chi-Xiang. So as part of the module, we worked on a real project with HealthServe, which is a VWO serving migrant workers. So we were looking at the health, what influences the health of migrant workers, especially those that had suffered injuries and were unable to continue working. So from this module, we were taught important skills in crystallizing what is the problem or gap we needed to address and how to create a roadmap to implement change. So as Prof. Yao likes to say, we learn to do the right things right. Okay, so now I show you all my pictures, all my unglammed pictures from my undergraduate days. So at the top left is the photo of my group from Prof. Liao's module. Top right is actually from my volunteering experience at Pearls Hill Care Home, which is a nursing home at Chinatown. So I spent my final year summer holidays volunteering there. So like what I shared earlier, developing empathy through learning about public health, it strengthened my passion for healthcare. And it shaped not just my uni experiences, but also eventually my career choices and my work experience. So talking about work, the bottom left photo is from my time at AIC, where I was a silver generation ambassador. So I engaged seniors and helped to communicate government policies and programs. I also applied skills I learned in public health by translating MOH policies and directives into processes for ground operations at our 17 satellite offices. So now I have moved into my current role, which is at NTUC Health. I work in the strategic operations team, and I'm involved in leading and supporting process improvement projects across 6 nursing homes. So in my work, I draw a lot of skills of like program design and evaluation that I was exposed to in the minor in public health. So in summary, the minor gave me a really good foundation in understanding and tackling a lot of the projects and challenges that eventually came my way. So with that said, 5 years on, I still have a lot to learn and I decided to pursue further studies. So in the beginning, I was honestly thinking just do the graduate certificate in health informatics because I was looking to upskill myself in the subjects of like AI and machine learning, which is like the hot topic right now. So in my current role with NUC Health, we have a lot of new initiatives looking at digitization and technology. So I wanted to upskill myself so that I could like negotiate with confidence when dealing with vendors that try to sell you like new fancy technology. So sometimes these technologies may or may not be useful in our operational processes in the nursing home. So from that point, I mean, once I started studying, I felt so interested and there were so many things to learn. And so I got sucked into the rabbit hole and now I'm doing my master's in public health. To be honest, doing a part-time master's is quite tough, but I think it's really worth it because there are so many like-minded and intelligent people in the master's program, and hearing their stories and experiences has helped me to see beyond elder care to what is happening in the healthcare landscape. So it's also kind of validated my experiences in trying to close the gap that often appears between policy and implementation. So to do so, you can't just be specialized in one area, but you need to have general skills across multiple domains, as well as deep understanding in key areas of those domains, which is why public health gives you that macro view. So I do hope that with the MPH, I can continue to stay relevant in the healthcare sector, and in the words of Prof. Chia Singh, to have capabilities 1 mile wide and 1 mile deep. Okay, so that is the end of my sharing. Thank you so much for listening. If you have any questions, or you can always reach out to me. My email is there. If you would like to come to NTUC Health for an internship, also feel free to apply. The link is there. So thank you so much. I'll hand the time back to the moderator.
Thank you, Amy. We're now at the last sharing session of today, and we have with us 2 current students, Sarah Christina, a year 3 life sciences student with a second major in public health, and also Jane Ann Teng from year 4 sociology student with a minor in public health, will be sharing both their experiences with you.
Thank you for the introduction. Okay, so hi everyone. I'm Sarah, and today I'll be sharing with all of you my undergraduate experience studying a minor and subsequently a second major in public health under the Saucy Hawk School of Public Health. So there will be a few things that I'll be covering today, starting with a little background about myself, followed by some key insights that I've gotten from my experience studying a minor and second major, as well as some of the many benefits that I have had the privilege to experience from these insights gained. So before we start, perhaps I could briefly introduce myself to all of you first. I'm currently a year 3 undergraduate student with a primary major in life sciences and a second major in public health. But when I first joined NUS, I was admitted with a minor in public health first, which I subsequently decided to upgrade to a second major last year. I'm currently also serving as the president of the NUS Public Health Club, which is a student-led platform for NUS students to explore their public health interests and also at the same time incite some change in the public health scene with some of their like-minded peers. Besides that, I also have served as an intern at Health Promotion Board last semester, which I will be elaborating more on later. So you might be wondering what motivated me to initially pursue a minor in public health. Well, when I was in JC, I was drawn to the healthcare field, like many of you, which was also why I took the BCME combination in JC. When I was applying for NUS, I was drawn to the term health in public health, so I decided to pursue it as a minor, even though I really didn't have a deep understanding of what it entailed at that time. Initially, my view of healthcare was very much focused on patient care in hospitals and clinics. But after going through these public health courses, I realized that public health really transcends just the reactive treatment of diseases, which I'm sure all of you have heard from Dr. Raymond and Prof. Andre. Yeah, but it is really a multidisciplinary field that emphasizes prevention and addresses the broader determinants of health, such as social, environmental, and economic factors, among many other things. So this realization really deepened my passion for public health and motivated me to upgrade it to a second major. So now let me share with you some key insights that I've gained from studying a minor and second major in public health. This is actually from the course that Amy was talking about under Prof. Chi Xia Ling. Yeah. So one major takeaway was actually learning to design effective public health programs that are tailored to different segments of the population. So as we all know, crafting programs that suit specific demographics is really crucial for addressing public health issues to reduce disease rates and enhance overall well-being. So we really learned through a detailed health planning and program cycle, which included a comprehensive analysis of the issue at hand and engaging with various stakeholders in order to come out with an innovative solution. We also had the chance to design surveys and interviews to assess the actual needs of our target population. So the real highlight for me was actually the opportunity to engage in a collaborative project with RISE, ex-community care from Alexandra Hospital, to create an intervention aimed at enhancing preventive health outcomes in working adult population by promoting increased screening. We got the chance to put our theory into practice and conduct some in-depth interviews to really gain a better understanding of our target population's needs, which was a very insightful experience. Another key insight that I gained from the School of Public Health was actually what Professor Andre just now has already covered, which was delving into the principles of health lifestyle and behavioral change and health promotion. I learned about how common lifestyle health behaviors such as smoking, diet, physical activity, alcohol, and even sexual behavior are all influenced by a spectrum of factors across various levels, including the individual, interpersonal, community, and policy levels. So this really made me realize that health behavior is often shaped by many factors that are simply beyond an individual's direct control. So this holistic perspective really taught me the importance of developing interventions that not only consider the individual behaviors, but also address and tackle the larger context in which these individuals live and work in. So the next key insight is probably one of my most memorable experiences that were facilitated by the School of Public Health, which was participating in the course Health of the Poor in Asia, which is what Prof. Raymond did talk about just now. This unique experience, when I was in there, we actually got the chance to go to Cambodia, which offered us a first-hand exploration of global public health and a chance to gain insights into population health that is within a different societal context than Singapore. During our time in Cambodia, we got to delve into the biggest health issues that really disproportionately affected the poor in the country, and we got a deep understanding of the systematic and the societal factors that are influencing the disease burden and the adverse health outcomes among this subgroup. The highlight of the experience, of course, was our immersive trip to Cambodia, where we got to visit the health centers, the hospitals, non-profit organizations, and even the villages. So we could really see we had the chance to actually interact with the target population that we are interested in. This exposure really allowed me to gain a better understanding of Cambodia's health landscape and the challenges that is faced by them. So of course, this experience was very unique and enlightening, and it was a very rare opportunity for me to step beyond Singapore's borders and witness firsthand the realities of health systems in other countries. So this brings me to the next point about how my second major in public health and the various skills and knowledge I have picked which has been proven to be beneficial to my professional and academic progression. I would say that the comprehensive curriculum has really exposed me to the various aspects of the field of public health, including health promotion, epidemiology, research, policy, and even infectious disease modeling, which has given me a really versatile skill set and opened up numerous career opportunities for me to consider in public health. For example, like my knowledge in molecular biology combined with my major in life sciences can allow me to consider specializing microbiology focused on human diseases. If not, I could engage in public health research within academia to study intervention effectiveness, or I could also work with governmental health organizations like Health Promotion Board to design and implement interventions for different age groups. So these possibilities really just scratch the surface of the many career paths that are available with a background in public health. Now, speaking of Health Promotion Board, let me share with you my experience being an intern at HPB, where I had the incredible opportunity to put the valuable skills that I gained from my education at Saucy Hawk School of Public Health into practice. As an intern at the Physical Activity Division, my role really involved assisting in the planning, the executing, and monitoring of various physical activity public health programs designed for individuals of all age groups. So I had the chance to contribute with my knowledge and skill set to the design and execution of one of our new pilot physical activity programs tailored for beginners. So I drew on some of my knowledge learned from designing public health programs, and I introduced my team to some of the frameworks that I learned at school, which did prove to be useful during the planning phase. Besides that, of course, the research skills really assisted me to conduct literature reviews on topics related to physical activity and public health. Besides that, my exposure and knowledge in public health in planning and designing public health interventions has proven to be very useful in various public health case competitions that I have participated in. Among the competitions that I've been involved in are like the APRU Global Health Case Competition and the NUS Public Health Challenge. They really provided me with valuable opportunities for me and my team, many of whom are also public health minors and second majors, to apply our skills in literature reviews, program planning, and conducting baseline surveys when developing innovative solutions to address real public health issues. So of course, these experiences were incredibly enlightening and enriching, and they wouldn't have been possible without the knowledge and skills that I gained from my education at SPH. And this is actually a small side point, but a big advantage of being a student in public health is the exposure to very valuable opportunities that arise. So in 2022, I received an email from the School of Public Health seeking student ambassadors for the Global Health Security Conference. So I decided to sign up, and I was very honored to serve as the student ambassador for the Minister of Health of Uganda, who is the woman sitting across me, alongside her team of Ugandan public health experts, including the Director General of Health, doctors, and the Program Director of CDC. I would say that the 3 days that I spent with this group was truly transformative in my life. Not only did it like significantly shape my perspective on public health and global health, it also provided very invaluable insights into the health landscape of Uganda and just other low-income countries in general, which inspired me to further pursue this path. It was, of course, an amazing networking opportunity, which many of you might be interested in too. So in conclusion, I would say that my experience with a second major in public health definitely proved to be a very enlightening, invaluable, and fulfilling one, which has had a significant impact on both my professional and my personal journey. It is definitely a choice that I do not regret at all, and I would do it all over again if I had the chance to go back. With that, I thank you all for listening, and please feel free to ask any questions that you may have later on during the Q&A. Now I'll be passing my time to Jane, who will also be sharing on her undergraduate experience with a minor in public health. Thank you, everybody.
Thank you, Sarah. So hi everyone. So I'm a year 4 sociology major and I minor in public health. And I only started this minor in my second year, so I didn't join when I first entered. And I just wanted to share briefly about my experience as a public health minor and maybe provide you some insights to this very interesting course. So actually, everyone has shared quite a number of things that I'm already going to cover, but I'm just going to reiterate those points. So some to provide some context first, I'm a sociology major, and sociology is a study of scientific and systematic study of human society and focusing on human social behavior and patterns of social relation and social interaction. So in layman's terms, we study various communities within the society and explore the different decisions made within this society and uncovering layers of inequalities and intersectionality. And in terms of my interest, I have an interest in social impact, looking into how we can improve other people's life by humanizing and empathizing. So with these two contexts in mind, let me share a bit of my main motivation. So number one, I'm very interested in understanding more about the health in the community. And I believe that with better health, we can have a better quality of life. So that is an aspect that public health allows me to learn more about and study more about. And secondly, the multidisciplinary aspect of NUS public health program allows me to cross-reference learned knowledge from this minor to my major very seamlessly. So some key learning points that I've gleaned from this entire experience is that public health allows us to view health of the population in both the macro and the micro perspectives, and also allows us to utilize project management skills to solve problems at a societal level. Yeah. So secondly, the program allows us to hone our communication skills and also the project management skills that I mentioned. So very importantly, it teaches us how to cater to large-scale program implementation, very large scale, so it's the entire community or the entire society. And secondly, it teaches us how to integrate both research skills, data analysis and all that, and this theory knowledge into implementation. So from textbook all the way to real life implementation, and teaching us how to turn found data into useful tools to activate changes. So, but I do want to mention that these are my learning points because of the field of focus that I've chosen to undertake. Because I'm doing a minor, so it's a very specific field of this program. And there's many other types of focus within the faculty. I've just chosen a route I've just chosen this route because it's something that interests me and I thought it coincides best with my major. So in terms of how it coincides with my major, so my major covers sociology, right? Covers a broad spectrum within the society, including health. And public health allows me to explore this interest of health in a more practical manner, especially in terms of policy planning and project implementation. So while sociology can be theoretical sometimes, public health provides a ground for real life application. So it enriches my entire learning academic journey. So it's not just learning from textbooks, but it's also being able to apply to real life. Yeah. And it's a very short sharing, but just overall, if you have the slightest interest in understanding more about community health or the various facets of it, be it tracking, understanding disease, you should give public health a shot. And one last point, public health program in Singapore is actually public health program in NUS is actually a very hands-on program, and you get to learn through multiple real-life contexts and examples. So if you will definitely have a lot of fun and it's a very, very engaging learning experience. So if that is up your alley, you should definitely give it a shot. Okay, thank you.
Um, Thank you, Sarah and Jane. So we've now come to the end of the presentations, and we've come to the Q&A segment, and which I will be moderating the session. So please submit your questions using the chat function, or you can raise your hand, and you can find the raise hand function under reactions. So please take note that you'll be asked to turn on your camera and unmute yourself to raise your question. Okay, there's a question in the chat. What is the timetable like if we pursue public health as a second minor or second major, and where can we find the different modules available for public health? Any of the speakers would like to?
Yeah, thanks, Suni. I will take that question. Thank you for the question. So the public health minor program is actually an open program. So after you are successfully enrolled as an NUS student, you can declare this on the NUS system as long as you are before year 3 of the study. So when you are year 3 and above, you have to seek permission from the host faculty. That does not mean that you cannot enroll in the program, just that you have to seek permission because there are this time duration that's of consideration in order for you to fulfill the requirements of the course. The second major program is a closed application program. So there will be annual intake. The information will be available at our website, right? So students have to apply this, submit an application, and we consider on a case-by-case basis by the committee. So the entire list of courses for both the minor and the second major program are available on the school website. I think my colleague will be posting the website, our school website email address with the list of courses. I hope that answers the question, the two questions.
Yeah.
Yeah. Maybe
there's some more on the graduates.
Okay.
Yeah.
So have there been graduates of the public health programs who have found work in global health organizations? I think to find work in global health organizations, particularly in the international global health organizations like World Health Organization we're talking about, usually they will ask for people with a bit more experience and of higher qualifications, right? So the minor and the second major, it's probably more of entry level, and it's a kickstart, right? After you have complete the relevant courses, then I think has actually illustrated by Amy and all this, right? They go on to further develop their studies, to take on postgraduate studies, either a master's in public health and all this. And at the same time, they accumulate that kind of experience through the public health work that they're doing. And then eventually they would be considered for employment for the global health organizations. So that is one important aspect. Yeah. Statistics on the employment rate of graduates. I think that one you have to write in officially, probably through the email address. I think it's also provided at the school website. If we have that, we can provide you that with the general kind of statistics. But it suffices to say that in general, majority of our students from both the minor and the second major program, they're able to find work within 6 months after they graduate, based on the survey that we have sent. So over 50% of them find work either in the various public health organizations as illustrated just now, or they go on to pursue a further study in public health, either locally or overseas. Postgraduate diploma for public health, yes. So we also currently offer that. So again, after you have graduated, you can be considered for that, right? Yeah. So I think all
Okay.
the
Dr. Raymond, there's also this question about, is there a talk or engagement for MPH offered by the school?
is there where is the question?
Is there a talk or engagement for MPH offered by NUS?
Yeah, so what happens is there will be a postgraduate fair for that. So do watch out. I think it's held every on an annual basis, a postgraduate study fair by NUS as well as the other university. So in that, we will feature the postgraduate programs. So again, do keep a lookout for that. Otherwise, we also have the accompanying information on the school website as well. You're welcome to write in and we will provide you with more information. Yeah.
Okay, maybe last few questions. So there's one on duration of the public health internship, and someone has raised their hand also. Yep.
Okay. So the public health internship, it's actually, again, it's offered probably during the special term period. There's the semester break where you have to complete a stipulated number of hours with our industry stakeholders. So before we send you to the industry stakeholders, we will actually administer a survey questionnaire to find out your interests and your skill sets and all this so that we can match you with the relevant public health healthcare organizations. Then throughout the public health internship, at the beginning, we will have a talk and a workshop to prepare you for that, as well as a mid-evaluation and a final evaluation to help you tie through that. Yeah. Again, more information is available on the website on the public health internship course. You can have a look at that. Yeah.
Okay. Maybe we go to the Jenny, who has been unmuted.
Hello. Thank you
Hello.
for answering my earlier questions. So just to clarify that just to clarify that for overseas organizations, normally they'll want something like postgraduate diploma or masters in your experience.
Yes, particularly for international global health organizations, most of the cases they would require certain postgraduate qualifications. But that being said, the case, I think we also wouldn't stop. I think there's no stopping students who have completed the undergraduate requirements, and particularly if they have a lot on their resume and CV to prove that they have a lot of relevant work experience, I think has shared by our alumni just now as well, and existing students who have a lot of experience, going on conferences, on internships, taking up internship and all this. I think that again adds to the credibility and the portfolio of the applicant. Yeah.
Okay, thank you.
Okay, maybe last question, which is how is the supply demand for public health minors? Is the industry saturated? Is maybe at pace? And is public health minor enough to get into policy and planning roles? Dr. Raymond?
Yes, yeah. Thank you for the question. Definitely the industry is not saturated. So the school is very, very concerned whenever we come out with any kind of a program. Prior to that, we conduct a very detailed stakeholder and needs assessment to assess the on-the-ground situation, including stakeholders' views as well as the job opportunities out there. So even before the development of these two programs, we have already engaged the various stakeholders and get the vacancies and all this and conduct a very detailed review. And we know that prevention and public health is gaining importance, more and more importance, right, in Singapore with COVID-19, with the implementation of Healthcare SG. So all the more we'll be seeing increasing need for public health professionals. And the landscape of healthcare in Singapore has also shifted from one that focused on treatment to preventive care. I think that is also widely reported by the media, and it's one of the important focus by the Ministry of Health. So it is suffice to say that definitely there is a demand for people with qualifications whether they take it in the during the undergraduate years or postgraduate years for public health. Again, we see it as a form of a continuum, right? I think as with any other job sector and all this, it's more of a growth and development. So I think after you have completed the minor and the second major in public health, most people will end up at a relatively junior positions. Then from there, they gather their experience and all this. We do have people after graduating with a minor and a second major in public health, they get to work in the various governmental agencies like Ministry of Health and Health Promotion Board, looking and reviewing policies and all this. And that's where they eventually, again, build up that kind of experience and probably then go through our postgraduate courses, then eventually they rise up the ladder. So I think this is very similar across any other job sector as well. Yeah. I hope that answers the question. Yeah.
Okay, we've come to the end of the Q&A. So if you still have more questions, please, you can scan the QR code and submit questions via the e-form. So I'll leave this page on for a while. Maybe a few more seconds. Okay, yep. If not, do drop by our booth at the College of Alice and Peter Tan U Town Multipurpose Hall booth D4 this Saturday to find out more in detail, and the school will be there from 9 AM to 6 PM. Okay. So Prof. Liao Qisiang, Vice Dean Education, will be conducting a talk on why public health at the Stephen Riady Center Level 1, Seminar Room 1, Area A11. So there will be two sessions. Session 1 will start from 10 AM to 11 AM, and session 2 will start from 2 PM to 3 PM. So see you on Saturday. Okay, thank you, and do follow us on our social media. Thank you.